Hello, I'm Sylvia Azania, and in this video we are going to talk about the primary reasons for infertility within a couple. We will talk about the causes of female infertility and male infertility, about the combined or mixed infertility, and we will also discuss about infertility with no apparent cause. In addition, we are also going to respond to several of the most common questions that users might have concerning this subject matter. The fertility issues experienced by a couple may stem from the male partner, the female partner, or indeed both individuals involved in the relationship. Once the relevant fertility tests are performed, it is estimated that in 30% of cases the cause is male and in another 30% female. The remaining 40% is precisely divided into a mixed or combined cause in 20% of all cases, and an infertility of unknown origin in the other 20% of cases. If there is infertility due to a mixed cause, both partners in the couple would be experiencing fertility issues, which would be leading to the difficulties in conceiving their baby. On the other hand, in cases of infertility of unknown origin, no explanation for the problem is found in the tests that have been conducted. When talking about female infertility, the issue could be found at several different levels, or indeed be caused by a variety of factors. Thus, we can talk about ovarian factor, tubal factor, cervical factor, and uterine factor. Concerning the ovarian factor, hormonal changes during the woman's menstrual cycle can impact ovulation. The endocrine or hormonal system is responsible for controlling the ovarian cycle. An alteration caused by stress, obesity, low weight, specific thyroid problems, the use of certain medications, etc., can affect the normal functioning of the ovary. In order to assess the ovary and ovulation, ultrasounds and hormonal blood tests are performed. Regarding the tubal factor, it refers to any alteration, damage, or significant problem in the woman's fallopian tubes. This part of the female reproductive system has two fundamental roles. Allow the meeting of the egg and the sperm so that fertilization can occur, and helping the embryo to reach the uterus, which is the location where implantation and gestational development occur. Therefore, if the fallopian tubes do not perform these functions correctly, the woman can have fertility problems. This happens especially when there is a blockage in both tubes, as can occur in cases of salpingitis, malformations, hydrosalpinges, or even endometriosis, among others. In order to diagnose a tubal problem, a hysterosalpingography is usually carried out. This test allows us to assess whether the fallopian tubes are permeable. If at least one of the tubes is permeable, that is, it is not obstructed, pregnancy could occur. Conversely, if both fallopian tubes are blocked, the necessary meeting between the ovum and the spermatozoon for fertilization will not take place. Given this situation, it will be necessary to resort to in vitro fertilization to seek a pregnancy. Regarding the cervical factor, if the sperm are unable to pass through the cervix or the neck of the uterus, they will not be able to reach the egg to fertilize it. For this reason, abnormal growths that develop in the cervix, such as polyps, as well as alterations in cervical mucus, infections or inflammation of the cervix, might be a reason for female infertility. Tests like a hysteroscopy or microbiological cultures are requested in this case, for example. Finally, we will discuss the uterine factor. Alterations in the uterus, whether uterine malformations or problems in the endometrium, could definitely be a cause of infertility in women. The implantation or the development of a pregnancy to term might be made more difficult. The most common alterations include conditions such as endometriosis, myomas, and polyps. And before continuing with the content of this video, I'm going to ask you that if you are enjoying it, please give it a like and subscribe to the channel if you haven't already done so, since you help us a lot to continue and for all the information we publish to reach more people. As for male infertility, there are different potential factors that can produce it. We can talk about pretesticular factors, testicular factors, post-testicular factors, and sperm factors. The pretesticular factor is due to hormonal alterations. An inadequate hormonal control in the male can cause serious alterations in testicular development, also in the seminiferous tubules, in spermatogenesis, the process of sperm production, and in the male reproductive system. To properly detect a hormonal cause of male infertility, a specific hormonal blood test would need to be performed. The testicular factor relates to any issue within the testicles, whether it is congenital or acquired. The congenital defects are usually due to a genetic abnormality, such as Klinefelter syndrome. The acquired defects can actually be due to various medications, drugs, severe infections, and various traumas. Conditions like varicocele or chitis. The post-testicular factor is caused by changes or issues in the seminal ducts. The seminal pathways are the ducts that sperm must travel through to exit to the outside once they are produced in the testicles. The epididymis, the different ducts, and the urethra. In this case, infertility may be due to infections, blockages, or serious physical injuries that prevent sperm from being released during the process of ejaculation. Finally, the sperm factor, which is the most common cause of male infertility. It is actually caused by problems with the sperm cells. The most common alterations concerning the sperm cells are the following: oligospermia, low quantity of sperm cells; asthenospermia, low level of movement in the sperm; teratospermia, an elevated quantity of sperm cells with an abnormal shape; necrospermia, an elevated quantity of dead sperm cells; azoospermia, a complete absence of sperm cells in the ejaculate. In order to evaluate a sperm problem, a semen analysis, which is known as semenogram, must be performed. When evaluating the causes of infertility in a couple, in 30% of cases, it can be due to a male factor, and in another 30% of cases, to a female factor. However, in some cases, both the man and the woman in the couple might experience fertility issues. In other words, the fertility issues will arise from the combination of both the male and the female factors. This is known as infertility of mixed or combined cause and occurs in 20% of cases. When the cause of infertility is unknown, we refer to it as idiopathic infertility or infertility of unknown origin. Infertility of unknown origin is currently observed in approximately 20% of cases. Despite performing the relevant tests, no problem is currently found, which justifies the failure to achieve a pregnancy. This does not mean that there are no alterations in the couple. But with the necessary tests performed, a determined diagnosis has not been reached. Some specific medical diagnoses are extremely complex. It is possible that with the currently available tests, the exact cause of the infertility may not be determined. Even so, the fact of not having a determined diagnosis does not prevent assisted reproduction treatment from being carried out. And now we are going to answer some of the most frequently asked questions that users may have related to this topic. What are the causes of infertility at age 40? The main cause of infertility at 40 years of age is precisely the age factor. In women, the quantity and quality of the oocytes diminish as age advances, which can complicate the successful conception of a pregnancy. In the case of men, at the age of 40, there is not as marked a decline in fertility as is observed in the case of women, but the overall semen quality does indeed decrease. If we already had a child, what could be the cause of infertility in a second pregnancy? The fact that a couple has previously had a child does not assure that issues will not arise when attempting to conceive a second time. This situation is referred to as secondary infertility. The reasons behind this secondary infertility are many and varied. Therefore, the fertility study must be performed on both members of the couple. In many instances, this secondary infertility is directly connected to the progression of time and advancing age, because fertility, particularly for women, diminishes as the years go by. We would love to hear about your experience, so please share it with us in the comments section.